Maybe you're dealing with edema, which can cause swelling in your legs, shortness of breath, or certain skin problems. Or maybe you're having severe heart or kidney problems. Then it might be that your doctor is prescribing you Bumetanide. In this video we will cover how and when to use it, what side effects it can cause, what dosage you need, and much more. So make sure to watch the whole video so you don't miss any important information. And for those of you I'm meeting for the first time, my name is Raoul, I'm a medical doctor from the Netherlands, and it's my mission to medically educate you, my viewer. So let's get started. So, as mentioned, the generic name of this medication is Bumetanide, which is sold under the brand names Bumex and Burinex, and is available as a tablet or through an injection. Which brings us to how to use it. If you want to use it as a tablet, just swallow it whole with half a glass of water. And if you want to use it as an injection, then don't worry, your doctor or your nurse will administer the injection. You usually do not need to do this yourself. Furthermore, if taking it as a tablet, make sure to do so at a fixed time. This will make you less likely to forget a dose. In addition, one of the best times to take this medicine is in the morning with some breakfast, as it will cause you to urinate more, and for obvious reasons, this effect can be very annoying during the night. So it's often advised to take it in the morning. Bumetanide is a diuretic, also called a water pill. It causes you to pee out unnecessary salts and water, which results in an increased production of urine. This will make you pee more often and decreases stress on your heart. Through this effect, Bumetanide can be used to treat fluid retention, also called edema, in people with congestive heart failure, severe liver problems, or severely impaired kidney functioning. When taking Bumetanide as a tablet, it will be effective within about 30 minutes up to 2 hours. Which brings us to the correct dosages to use. And here I want to mention that I can only provide you with a guideline. Always use the prescribed amount and frequency your doctor gave you, as your specific dose might depend on your indication of use, the severity of your symptoms, and of course, side effects you might experience. However, most doctors will start with an initial dose of half a milligram up to a milligram in the morning when taking Bumetanide as a tablet. This dose could be repeated every 6 to 8 hours. Now, Bumetanide is a very effective drug, but unfortunately it can also cause some side effects. I will discuss some of the most common ones in this video, but if you're looking for a complete list, then ask your doctor, your pharmacist, or check your leaflet. The following side effects are seen when using Bumetanide. Commonly, it could cause electrolyte disturbances, dizziness, a low blood pressure, headache, and fatigue. Uncommonly, it can cause bone marrow failure, blood cell disorders, dehydration, eczema, and edema. Which brings us to the safety of use. And here I want to mention that the usage of Bumetanide, especially the first few weeks when you're using it, could cause certain side effects like dizziness. If you do experience any of these, then please do not drive, as this could obviously be dangerous. Furthermore, in moderation, it can be combined with alcohol, although combining it with alcohol could increase certain side effects. Therefore, always be careful when doing so. In addition, the usage of Bumetanide could lead to potassium deficiency in your body. To prevent this, you should eat potassium-rich food, like citrus fruits. Next, Bumetanide could also have interactions with other drugs you're taking, therefore always discuss this with your personal doctor. And lastly, Bumetanide can be dangerous for those of you which are pregnant or which are breastfeeding. Always discuss this with your personal doctor. I hope you know now how to use Bumetanide, but if you have any questions, let me know in the comment section. And for those of you that want to keep on watching, check out the playlist in the description with more awesome medical videos. I want to thank you so much for watching, and if you did learn something, please click the like and subscribe button. It will help out the channel tremendously, it's free, and in return you will get notified each week with a new awesome video. Also, check out the TikTok, Instagram and Facebook channel at How to Medicate for more awesome content. And otherwise, I will see you next week with a new video. Bye bye.